Well, thank you for joining us today. I'm Jack Herman, Senior Director of the Disaster Cycle Services Client Care Program at the American Red Cross National Headquarters. I oversee many of our client-facing programs that are provided in the immediate aftermath of a disaster, such as casework, mental health, spiritual care, disability integration, and disaster health services.
And I am Mary Casey Lockyer, the program lead for Disaster Health Services at the American Red Cross National Headquarters. I'm a critical care nurse by background, and before taking on this role 11 and a half years ago, I was the emergency response coordinator for a 480-bed hospital in the suburbs of Chicago.
And I'm Jared Roberts. I lead the strategy team at Nursa. My background is in healthcare administration, most recently around technological innovation aimed at increasing access to affordable, quality patient care.
So today's presentation is really the launch of a Nursa Red Cross partnership focused on expanding the Red Cross Disaster Health Services volunteer base in response to the growing number of disasters across the country. Today, the Red Cross is responding to 9 large-scale disasters from California to Georgia and many states in between. These disasters are a result of unrelenting storms and blizzards in the Pacific Northwest and devastating tornadoes in the nation's heartland that have left many individuals injured and homeless. These storms have also, unfortunately, taken the lives of children and adults. Almost 1,500 Red Cross volunteers and staff are currently assigned to these disasters, providing food and water, emergency shelter and supplies, and a range of supportive services like mental health, spiritual care, and health services. We hope you will consider joining our efforts today or in the future as a Red Cross Disaster Health Services volunteer. Many of you are likely already familiar with the Red Cross, as the symbol and the brand is highly recognized around the world. The American Red Cross was founded by Clara Barton in 1881 in Dansville, New York, and for over 140 years, the Red Cross has been dedicated to compassionately serving people in need. Though not a federal agency, the Red Cross has been tasked by the federal government with providing services to members of the American Armed Forces and their families, as well as providing disaster relief in the United States and around the world. Our mission is to prevent and alleviate human suffering in the face of emergencies by mobilizing the power of volunteers and the generosity of our donors. We and our global network in almost 200 countries across the world are guided by our 7 fundamental principles, which include humanity, impartiality, neutrality, independence, voluntary service, unity, and universality. Today, as throughout our long history, the Red Cross depends on generous contributions of time, blood, and money from the American public to support our life-saving services and programs. We look forward to sharing more about our work in this presentation, specifically the array of health services we offer in the immediate aftermath of disasters.
As Jack mentioned, the Red Cross offers a range of disaster services to meet our clients' immediate disaster cause needs. At the core of these services are our sheltering and feeding programs. The Red Cross, in coordination with local authorities and partners, provides individuals and families with a safe place to harbor from a storm, as well as for those whose homes have been severely damaged or destroyed. We also provide food and water to those who may not have access to it, as well as spiritual care and mental health services to aid those struggling in the disaster's aftermath. And for many disasters, and because of the generosity of our donors and the American public, we are also able to provide minimal financial assistance to clients who meet our eligibility requirements and connect them to community-based resources that can further assist them with their immediate, intermediate, and long-term recovery needs. As part of our disaster relief mission, we have a team of dedicated volunteers who meet clients' disaster-related unmet health needs. People who have healthcare licensure, such as RNs, LPNs, LVNs, nurse practitioners, advanced practice RNs, EMTs, paramedics, and physicians qualify to provide this valuable support through our organization. These RNs, LVNs, and LPNs can function under their full scope of practice, but other licensure types will have tasks delegated to them from the RNs. Red Cross Disaster Health Services volunteers do not write any type of prescriptions. Meeting the client needs in a disaster situation often include replacing such items as lost or damaged medications, durable medical equipment, consumable medical supplies, eyeglasses or hearing aids, and in some of the larger scale responses, it may be necessary for our volunteers to provide hands-on care, such as physical assessment, wound care, or assistance with activities of daily living. Disaster Health Services volunteers also provide health education to equip clients with specific information on how to maintain their health after certain types of disasters, such as home fires, wildfires, hurricanes, tornadoes, and flooding, all of which can impose unique health complications for clients and the public's health at large in a disaster-stricken community.
For some of you watching, you may be familiar with the Nursa platform, but for those of you unfamiliar with Nursa, we are a healthcare staffing platform, driving better patient care by connecting highly qualified nurses looking for flexible work with healthcare facilities or provider organizations in need of staffing help. Our aim centers around providing opportunities for clinicians, as well as helping ensure patients receive the care they need when they need it, one shift at a time. We also believe technology can be an enabling change agent to empower clinicians to achieve their desired work-life balance, avoid burnout, and continue to experience joy at the bedside.
Over the last several years, and in particular since the COVID-19 pandemic, the nation has experienced an extreme nursing shortage, and the American Red Cross has been significantly impacted by this shortage, making it difficult to recruit licensed professionals to volunteer for our organization. Our partnership with Nursa provides a unique platform to reach more licensed healthcare professionals who may be interested in giving to their community during times of disaster. We hope many of you listening to this presentation will consider giving your time and compassion to helping those impacted by disasters. If you are interested in volunteering your time and making a difference to those impacted by disaster, please apply through a link that will be posted on the Nursa website for volunteering with the Red Cross, or you can apply to become a volunteer at redcross.org. In addition, you can also reach out to members of the Red Cross Disaster Health Services team directly by emailing us at disasterhealthvol@redcross.org with questions you may have about the Red Cross Disaster Health Services experience. We are looking forward to discussing any questions you may have or provide the opportunity to chat one-to-one with an experienced American Red Cross Disaster Health Services volunteer. So let's go through a few questions you may have. Where do I start? And what do I have to do to become a Red Cross Disaster Health Services volunteer? To be considered for a Disaster Health Services volunteer position, you must complete a Red Cross volunteer application, have a current unencumbered license in one of the following disciplines: registered nurse, licensed vocational nurse, licensed practical nurse, nurse practitioner, advanced practice registered nurse, emergency medical technician, paramedic, physician assistant, or physician. Unencumbered means that your license has not been limited by the State Board of Nursing or any other boards for any other reason. We also require that all Disaster Health Services volunteers have a current basic life support or CPR certification. How long is the training or orientation to become a DHS volunteer? The current requirement to be a Red Cross Disaster Health Services worker involves approximately 12 hours of specific Red Cross training. This training focuses on how to apply your healthcare professional skills to disaster clients and at a Red Cross disaster relief service site, such as a disaster shelter. Red Cross training courses can be completed through a hybrid format of web-based and virtual instructor-led training, which covers the basics of disaster health services, relevant scenario-based training, and guidance on how to provide financial assistance for health needs. How will I know if there is an opportunity to help or volunteer near me? While I hope you will volunteer with the Red Cross Disaster Health Services team, your local chapter can help you explore a variety of volunteer opportunities that utilize your valuable nursing skills. That may include supporting biomedical services, health and safety training, in addition to the work we do in disaster health services. Are there any areas where Red Cross has a particularly short supply of volunteers? Overall, the Red Cross is experiencing a shortage of disaster health services workers across the nation, especially in geographic regions most at risk for seasonal disasters such as wildfires, tornadoes, hurricanes, cyclones, and winter storm. But because the Red Cross also responds to 60,000 single and multifamily fires each year all across the country, they need more help everywhere. What type of professional experience will I need, and how will I use my professional skills as a Red Cross Disaster Health Services volunteer? Nursa clinicians have a wealth of clinical experience and skills. It's these, along with a passion to help people and an empathetic nature, that are needed to assist Red Cross clients impacted by disaster. As a disaster health services volunteer, you may be asked to provide services in shelters or at other Red Cross service delivery sites, such as community sites distributing emergency supplies or providing financial assistance to clients to address their disaster cause need, such as losing their medications, dentures, or hearing aids, or assisting them in getting access to their primary care network. It is important to understand the work disaster health services volunteers do is not emergency room or critical care in nature, or similar to the work you may be familiar with performed by disaster medical assistance teams, which are managed by the U.S. Department of Health and Human Services at the federal level. The services Red Cross Disaster Health Services volunteers provide are supportive in nature, similar to what you might find in community-like healthcare settings or home healthcare. In this role, flexibility is important and requires the ability to focus in on what healthcare services and information a client needs, and then connecting them to those services and information. As we come to the end of this presentation, I would like to share a story of a Red Cross nurse volunteer who encountered an almost term pregnant shelter client with no support system available to her at the shelter. This nurse volunteer was nearing the end of her deployment time, but requested to elongate her deployment to support this client during her labor and delivery at a nearby hospital. And so this volunteer was at the side of this client as she gave birth to a beautiful, healthy baby boy. This disaster health services volunteer will forever cherish that experience. So in closing, Red Cross is very excited to initiate this partnership with Nursa and is looking forward to seeing more licensed healthcare professionals assist us in our mission in their home communities and across the nation.
We at Nursa are so excited about this partnership with the Red Cross. Our platform is free to download for both healthcare facilities and licensed clinicians. And for those of you already active on Nursa, I hope that you can see the strong alignment with the American Red Cross's need, meeting clients in their own communities, the same communities you work and live in every day.
So on behalf of the Red Cross and Nursa, thank you for joining us today. And we hope to see you soon as a Red Cross Disaster Health Services volunteer. And if you do have a few more minutes, you might take notice of another link on the Nursa website, which will be a short video about a client that our health services workers assisted recently during a disaster operation in Mississippi after the tornadoes. So you'll have a firsthand experience of how the work you will be doing in this role will help others in their recovery process. So thank you for joining us.